All right, good morning, everybody. Let me go over the schedule for the week with you. First of all, like I said, thanks for understanding. Last week was kind of a difficult week in my house, and started out difficult with my daughter already being sick today. But this week, my intention is to cover infant CPR, teach you about it today, show you how to do it. Hopefully we have plenty of time toward the end of class to go ahead and test out of it. If not, we'll get it done tomorrow, because I do have up there infant CPR lab. Now, if anybody is missing any other lab, by the end of the week, without even having to come in here at lunchtime, by the end of the week we'll get tested out on that. Because Friday is actually a half day for you guys. So I think classes are about 28 minutes, and that's a good time for me to have anybody who is missing anything get caught up for me. I know there are some people who are missing their American Red Cross history flyer. They haven't turned it into me yet. You know, a couple other little things, but that would be a really good time to get that done. On Wednesday and Thursday, we're going to do a review and take the before giving care exam. Now let me talk a little bit about that. I split Wednesday into two parts. The first part of it, I give you the B version of the exam. I let you work through that, not using your notes, not talking to your neighbor, but work through that exam. Okay? And it's short. I think I want to say it's 20 or 25 multiple choice questions. Once you finish that, we convene, we go over it, I make sure you have the correct exam answers, and then from there, I let you keep that exam and bring it back the next day. Because the next day you take the A version of the exam, and the difference between the A and the B version is they just take the questions and they jumble them up and they throw them back into a different test. That's the whole difference. Now that's the way they had me do the test. That's what they said at the American Red Cross. It's okay to do it that way. So essentially, I like to do it that way to keep you guys on point with what I was taught. All right. The second part of that class, I have a Kahoot made. So we'll do the Kahoot and make sure you have your phones charged. And the Kahoot will be, again, what we'll talk about before giving care. And before giving care is, you know, checking the scene, checking the person, knowing how to roll them over, look, listen, feel, all that kind of stuff. Okay? Any question about Monday through Friday? Good. Let's talk a little bit about what you may not have turned into me yet. Okay? You owe me American Red Cross history flyer if you didn't turn it in yet. Some people sent it to me or shared it with me, which I don't want done. I want you to put it in the classroom from now on. I was a little bit more liberal than I wanted to be this time, but put it in classroom. If you don't know how to put it in classroom, please ask me. I will teach you. It's not a difficult process, but some people don't know how to do that. Not every teacher uses it.
Uses what?
Okay? How to turn something in through Google Classroom. Yeah. This week, the red group, which is my last group to do current events, you have one due, and the red group is, let me see, Renee, Donna, and Ivan. Okay? So those are my people who have it due this week. Please make sure you get that in. Remember, there's not a lot of homework that gets involved in this class, so something like that is important to make sure you get done. Okay. Any questions about any of that?
Oh, I couldn't find it. I couldn't find it.
It's actually in our classroom.
No, like, hey, you know how you made us tell us to make a copy of it?
No, all I wanted you to do was write a little paragraph about what your current event was.
No, the history thingy of the flyer. Yeah.
What do you mean you couldn't find it?
I couldn't find it. You told us to make a copy of it.
Yeah?
And then, like...
It's in Google Classroom.
Make a copy of it.
Once you open it up, you hit File, make copy of.
Yeah, and then I started working on it, but then when I went back, it wasn't there. But doesn't it automatically save?
Yeah, it does automatically save.
So it has to be somewhere, right?
Yeah.
Go to read.
Yeah. If we have a few minutes at the end, I'll let you log in. I'll pull a computer up over there, and I'll let you log in and pull up your Google Classroom, and I'll see if I can find it for you.
Okay.
Okay? Any questions from you guys? Comments, concerns? Great. Okay, so today, the first thing I wanted you to do is this quick warm-up for me. 3 differences between adult and child. Go ahead, Lorenzo, tell me the first one.
For a child, you start off with 2 rescue breaths.
Yes. Yes, absolutely. Another difference. Go ahead.
For adult, you do 30 compressions and 2 rescue breaths.
You do that for adult, child, and infant, though. Okay?
Oh wait,
Lorenzo did say that you start with the rescue breaths first. Okay? Alex?
For a child, you need to ask the parent as well as the child for consent, if the parent's there.
Okay. Okay. Go ahead.
For a child, you go down your chest progressions, you go down 1.5 inches.
Child, you go down 2 inches. Yeah.
And then adult 2.5.
Yeah. And the third one,
Come on.
I don't know if you
Logan,
guys know the third one, okay? I don't know if I covered this one with you.
Isn't it their feet?
No, that's with an infant. That's good that you remember that, though. That's really impressive to me. What the third one is with the child is, when you lean their head back on a child, you only got to go back about halfway or almost 3/4 of the way back to open the airway because they're not as fully developed. With an infant, you only got to go back about halfway to keep their airway open, okay? So it's how far back you lean the head back.
What if they start choking?
Well, that's a good thing if they start choking. That means they're conscious. So then you start giving them care for choking, and I'm going to teach that
How
to
do you
you.
take it out?
I'm going to teach you all that. Yep, I'm going to teach you all that. Today I have a great video that I want to share with you guys. This is about an infant who was in a car with her aunt in Miami, and the aunt noticed that he had turned blue while she was driving, and she explains it in detail. It's about a 3.5-minute video, but it's really good.
Well, a 5-month-old baby in Miami is alive tonight thanks to his aunt, emergency responders, and the kindness of strangers. Sebastian de la Cruz is in the hospital in a critical but stable condition after a scare that no one would describe as nightmarish. Pamela Rossio was stuck in traffic with her nephew, Sebastian, strapped into his car seat in the back when the baby stopped breathing. The pictures captured by a Miami Herald photographer who happened to also be stuck in traffic tell the story. A frantic Pamela screamed for help and repeatedly did CPR on her baby nephew as police officers and strangers came to her aid. Very heroic. Pamela joins me. Pamela, explain when you realized something was going wrong with your nephew.
Well, I was driving and he was sitting down directly behind me, so I couldn't see him. And then he stopped crying. And that concerns me because usually when I'm in traffic, if the car's not moving, he'll start getting fuzzy. And once the car starts moving, he'll calm down. So I didn't understand why he was calm when we were at a standstill, and I pulled over to the left. I put the car in park, and I jumped back to check up on him. He was pale and unresponsive, so I quickly got him out of his car seat. I went back up to the front with him all the time, like calling him to see if he would respond, and at the same time, I was trying to use the OnStar system in the car to dial 911, but I was just too nervous.
Was he turning blue?
And he was blue. He was blue, and then he was purple.
Oh my gosh.
And
you began asking for help, calling out.
I got out of the car immediately, and I started screaming, asking for help, and kind of like signaling that it was for the baby, like, look, I have this infant in my hands, somebody help. And 2 people came, and I asked them if they knew CPR. They said no. I asked them to call 911. They did. And the lady, she was amazing. She helped keep me calm. She kept telling me that he would be okay. But since they didn't know CPR, I dropped down to my knees, and I started doing what I thought was right.
Had you ever taken a class or anything?
I have.
Wow. So did you remember everything, or just a few things that you just started to do?
Listen, I was a hot mess. If my life depended on it, I cannot tell you what I did, but I promise you I did not do what I was supposed to do. I don't know how it worked.
These pictures, the photographer happened to be there as well. Once he saw that the help was there, he started taking pictures. These photos are just extraordinary. Was the baby conscious? I mean, when he was turning blue, were his eyes open at all?
No, he was completely, his eyes were closed, he was completely unresponsive. The baby eventually regained consciousness again as I was performing CPR on him. And then once he regained consciousness, fire rescue was there. They then took the baby from me, and they were wonderful.
Do you know how long this went on for? I mean, I know in these situations it's hard to tell time often, but do you have a sense was how long you were doing this for?
Well, if you ask my imagination, I'll tell you it was like 10 years.
Right.
That's how long it seemed. I'm guessing it was maybe 6-7 minutes, the whole ordeal from the moment that I got out of my car.
And how's Sebastian doing now?
He's stable, thank God. He's still in the hospital. The doctors are still running a series of tests to determine exactly what it is that's causing him to have difficulty breathing.
So it's kind of, to me, it's pretty interesting that she actually sort of remembered, but if you look at the pictures of what she's doing, they went straight into the pictures of her giving breathing. And to be quite honest with you, as much as that is important with giving the care, the compressions are just as important. Okay? So our objectives today, to be able to demonstrate how to perform CPR for an infant, apply the procedure, check call care, all right, to be able to identify signs of cardiac arrest in an infant. With an infant, it's different than an adult in that it usually doesn't start as a cardiac emergency. What's it start as?
Breathing.
Right, a breathing emergency. So perhaps they caught her in the early stages of giving the care, I told last class, and I'm going to tell you guys the same thing. As long as you stay current, you'll be comfortable when you run into that situation. Okay, as long as you stay current with your certification. It really is a pressureful situation, but if you have confidence in what you've learned how to do, and you continue to get your certificate every couple of years, you'll be fine with it. As with an adult, use the check call care format that we use. Determine if that infant needs CPR. Check the scene. If the infant doesn't respond, you guys don't need this. Check the scene. If the infant doesn't respond, have somebody call 911. Now, in terms of applying the care, you have to decide what's going to be most necessary at that point. Do I need to get any compressions because somebody saw this, or do I go right to rescue breaths like I've been taught? Okay? One of the things that I want you to take notice to is the last sentence of the top part of the notes. It says, child must be on firm, flat surface for CPR. If you look where I have that child right there at the front of the room that I'm going to use to do my hands-on demonstration for you, it's at the top of the desk. It's on a desktop. The desktop is hard. The lady in the pictures, she was kneeling. She was holding the baby. You're not giving compressions to a baby doing that. You know that. I told you. They got to be on a hard, flat surface, whether it's an adult, child, or infant. With an infant like that, the higher the surface, the better you're going to be able to work with that infant. Yeah.
What could she have done? Because obviously she couldn't do it in the car, and she probably wouldn't have put the baby down on the pavement.
Right. So, okay. She's in Miami.
That's true.
Yeah, that's great. Great answer. The trunk possibly. She's in Miami. Most likely the car is hot, right? I mean, most likely it's pretty hot. So yeah, the trunk is a potential thing because she probably had the air conditioning going. So the trunk's probably not quite as hot inside. All right. The other piece is she's in an SUV. She could open the hatch, drop the seats, and put the baby there. But I mean, that's a tough call. That's why I say, we see a situation here where the baby goes from consciousness to unconsciousness to not breathing to no heartbeat. Can you imagine having somebody in the car, an adult, an older person, even somebody your age, and you've got to drag them out and start giving them care? That's going to be kind of a daunting task. You might panic a little bit in that situation. I think the lady did pretty good for everything being considered, you know. I mean, you look back there and the baby's already turning blue, which means who knows how long it has not been breathing, and it doesn't take long. So I use the desktop, and when we test out in here, I'll just flip the desks around, and you'll stand on one side of the desk and be able to do your CPR for an infant. Okay. Well, let's go ahead and watch the video, and I'll teach through the video. You do have one question on page 9. The question says, and it's about halfway down, it says, with an infant, you can always keep an infant's head back when you're giving care. Always. And you're going to see that in the video. You can use one hand to have the head back, give compressions. You can have one hand to have the head back and give your rescue breaths. Okay, so you can always have their head back when you're giving care to an infant.
Knowing how to correctly perform CPR will help you provide care to an infant having a cardiac emergency until another trained responder or EMS personnel take over. First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. So, watch closely, you'll practice soon. Now get ready to practice CPR. Position yourself next to the infant mannequin, with your gloves on and your CPR breathing barrier ready. Place one hand on the infant's forehead to keep the airway open. With your other hand, put 2 or 3 fingers in the center of the infant's chest, just below the nipple line.
Okay, so notice his hand right away. He's got the baby's head back. All right? You can always keep it back. The next thing, 2 to 3 fingers when giving a compression to a baby. You don't want to use interlock 2 hands to give a compression to a baby. Chances are you'll press its heart right through its back if you do something like. I mean, you think about how fragile a baby is. Okay, so we definitely don't want to do that. All right.
No matter what fingers you use.
You're going to use 2 to 3 fingers, so it doesn't matter which hand it is.
If you feel the notch at the end of the infant's breastbone, move your fingers slightly toward the infant's head. To give chest compressions, position your fingers pointing straight down and push hard and fast on the chest, about 1.5 inches deep. Now, give 30 chest compressions. Try to keep an even pace. Counting out loud can help you. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12.
Each compression should be smooth. Let the chest rise completely before pressing down again. When you come up, be sure to keep your fingers on the chest. Okay, stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
Okay, stop. CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then make a complete seal over the mouth and nose. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. Your instructor will now pause the video and help you practice giving rescue breaths.
Because your mouth will cover the nose. And infants,
Now practice doing
mouth and
cycles
nose.
of 30 chest compressions.
But won't you like breathe inside the nose? That's
But,
nasty.
now listen, you got a mask there. If you don't have a mask, I understand what you're saying, you can just get the compressions. We've talked about that. But in terms of having that mask there, your mouth will cover that nose. So it will keep,
What's considered a child like at the age and like 11?
an infant goes up to, it's categorized as up to 1 year old, okay? Then a child is up to 12 years old. Then from 12 and older, you're considered an adult based on CPR and AED.
Followed by 2 rescue breaths. Get into position, place one hand on the infant's forehead to keep the airway open, and put 2 or 3 fingers of your other hand in the center of the infant's chest, just below the nipple line. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, and 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28.
Okay, stop. Your instructor will pause the video to give you some feedback. When we begin again, we'll put together all the pieces you've learned to simulate a real response.
I'm just gonna let it keep rolling through, guys, as I always do.
Now let's simulate a real response, from checking the scene to checking an unconscious infant and through a few cycles of CPR.
This is just like we did with adult and when we did child. This is the way I test you out of it. You'll get your prompt, you'll do the next step. I'll give you a prompt, you'll do the next step.
Stand a few steps away from your mannequin with your gloves on and your CPR breathing barrier ready to go. On my cue, check the scene for safety, then check the unconscious infant. You will be given only the information necessary to make a decision about what to do next. Ready? Go. The scene is safe.
Baby, are you okay?
There is no response.
Call 911, this baby's unconscious.
Check it out, I'm gonna show you something. I'm Gucci.
Safe.
Baby, are you okay?
What's he not doing correctly right off the bat?
Touching the feet.
Yeah.
Didn't touch the feet.
did.
You
He
know, that
he
is
flicks,
super.
he
Yep,
touches
you
the
gotta
feet.
flick the foot to see if the baby.
He does.
The baby's not gonna respond. That baby leans its head up and says, I'm straight, it's good. You know, it's scary. You know, it'd be like a Chucky movie or something.
He does.
Yeah, I did.
Oh,
There
now
is
he
no
did.
response.
Call 911, this baby's unconscious.
Can you like
That
take
should be
a-
something you instantly do
Can you
though.
like take a peek? See if they're
3,000, 4,000, 5,000,
They're gonna respond.
6,000,
If
7,000,
they're alert, if they're
8,000,
awake, they're gonna
9,000,
respond
7,000.
if you do that.
There is no breathing.
Okay, so you did do the breath work, alright.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14,
Like,
15,
if
16,
you've been
17.
like smoking or something, and then like
You've been smoking?
yeah, and then like you see somebody like that, and you know how to do CPR and stuff, but like
Blow
you're like
out
a
the
little
smoke
bit,
and
you're
then
like
do
a
the whole
little
thing?
bit nauseous. I mean, you're like a little bit like not sure if you should do it because you know you.
Then I just do compressions. I mean, if you're conscious enough to know that, look, I really shouldn't be doing this, I don't wanna hurt that baby any further, but I can do this, then that's when you would just do the compressions.
18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29,
stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator or AED is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue. Or the scene becomes unsafe.
Okay, Dower, you had a question.
So after 2 minutes, should they be like responsive or not?
Just depends. I mean, I can't sit here and firmly say, yes, they'll be responsive, because that might not be the case. We don't know that. You know what I mean? Like, we don't know what it's gonna take to make that child responsive. You might be giving CPR for 6, 7, 8 minutes before EMTs arrive, and that baby may never gain consciousness.
But then the baby will die.
Well, and we don't know, that could happen. You know what I mean? Like, it's not something that we can actually pinpoint and say, yeah, this is gonna be the way it's gonna work out.
But the baby?
You know, like I teach you often, like I talk about often, I'm giving you the skills to be able to try and help somebody save their life. It doesn't necessarily mean you're gonna save it. You know. All right, in your packet, I think it's page 10. It says steps to infant CPR. Let's go ahead and get these written in for you. So what's the first thing I'm gonna do, Javashri? Check and check the scene and check the person. Okay, so check scene. And the person. Turn that just a little for me. Alex, turn that just a little. I'm gonna get this up here. Okay. Now what are we going to do, Lorenzo? We've checked the scene, we've checked the person. We checked the scene, we checked the person.
Call 911.
There you go, thank you.
Don't you gotta ask for permission?
We will naturally assume that we've been given permission here. But you're absolutely correct. Now we've called 911. Now what? Let me go to Sophia.
You do the head tilt,
Head tilt, chin lift, and what do we do?
Oh, look, listen.
For how long?
10 seconds.
Right. So we'll head tilt, chin lift, and we'll L, L, F. Look, listen, and feel for 10 seconds. Okay? We get no response. Chris, what do I do next?
Rescue breaths.
How many?
2.
2 rescue breaths. I've done my 2 rescue breaths. Now what? Go ahead. 30 compressions. Good. When I give a compression, how is my hand or how are my fingers? How many?
2 or 3 fingers.
2 or 3
straight up and
fingers.
down.
Straight up and down, exactly. Rescue breath, do I need to pinch off the nose?
No.
No, I don't. Okay? So I'm in a good position at this point. I don't need to worry about the nose. My mouth will seal over it. If I don't have a mask and I'm uncomfortable with it, hey, that's fine. Just do your compressions. Just do your compressions. All right?
What is the baby gonna have?
What if what?
What kind of diseases will the baby have that can pass to you?
Well, you've had health, right?
Yeah, but it's a baby.
That doesn't matter. Can a baby be born with HIV?
Yeah, you can't pass it to them.
If you're a freak, you can.
Yeah, well, you know, I mean, how about something else?
Herpes?
Possibly. That'd be, yeah. You know, you've got to look at it from every aspect. You've got to take care of yourself first.